Good afternoon, and thank you for coming. Today I was asked to talk about sleep, which is my other part of practice that we do in the office and in the hospital here. And sleep is a big subject, so we'll focus on sleep apnea. And sleep apnea means temporarily stoppage of breathing during the sleep. And that can be either from the brain center stops firing, and that's what we call central apnea, and that's rare, and that's not the focus of the talk today. And the other part will be blockage or temporarily blockage of the airways, and that's the more common one, and that's the one we call obstructive sleep apnea. It is very common. It is underdiagnosed. About 8% of the male adults, they have it. A lot of them, they don't know they do. And about 4% of female adults. So it's more common in males than females. It can affect anybody from a few months old to 90 years old and anything in between. Why we are more interested in it now and why we pay more attention to it, because we know more about it now. There are three reasons we check for sleep apnea, and we make sure that we pick all the, or as much as possible, of patients who suffer sleep apnea and try to help with it. The number one reason is the immediate complication or effect of sleep apnea. And that includes fragmented sleep. People who are having sleep apnea, they don't sleep too good at night. When they wake up, they don't feel rested. A lot of times they have headaches, they have aches and pains. If you're not getting quality sleep, even if you think you sleep enough, but it's not a quality sleep, your memory will not be as good, your concentration will not be as good, and the mood will not be as good. So depression is very common with sleep apnea. And people who study, go to school, or trying to get any degrees, they get so sleepy during that, so they cannot get enough or pay enough attention. And people who work, sometimes they get in trouble because of that. And sometimes they will be labeled as lazy because they're not getting any quality sleep and they get sleepy. So that's number one reason, not to mention also the incidence of car accidents and accidents in general. It's much higher. It's about 700% more the motor vehicle accident if somebody has sleep apnea. Some of the major disasters happen related to sleep apnea. If you remember, and I'm sure all of you remember, Chernobyl disaster in the old Soviet Union. It happened because of sleep apneas. A lot of car accidents. Several months ago, I was looking at one of the local news papers, and they were talking about one of the accidents there, and it was, I think there was one or two died in the accident. And I saw the driver, and I can tell he has sleep apnea. I mean, there's some features, and if you practice enough, it was not mentioned there, but just the feature of sleep apnea. So that's number one reason. Number two is the long-term complications. Patients with sleep apnea, they tend to have more blood pressure. So they have hypertension about 2-3 times more than somebody who doesn't have it. And if they have it, it will be hard to control. So you see them in several antihypertensive medications and their blood pressure yet not controlled with that. Patients with diabetes, it tend to be less controlled with that. Heart attacks and congestive heart failure is more common with sleep apnea, and strokes also. So all these serious complications can happen because of or made worse by sleep apnea. And the third reason is it's the innocent bystander victims who are the spouses. If somebody has sleep apnea, the bed partner doesn't sleep good. Snoring is loud, restless movements, and also they notice that they stop breathing, so they get worried, so they just keep watching them. So a lot of times I get the patient referred by their spouses because of that. So these are the three major reasons we focus on sleep apnea, and we try to diagnose it and treat it. Now, what are the signs and symptoms? It's what I mentioned, but I'll summarize it. You can have one or more of these things. Main thing is sleepiness and tiredness during daytime, headaches in the morning, aches and pains, sometimes depression, uncontrolled blood pressure, uncontrolled diabetes, restless sleep. These are the main things. And if you look at the person, there is no single cause for that. But the people who are overweight, they tend to have more chances of having sleep apnea. People with enlarged tonsils and adenoid, that also narrow the airways and make it hard for them to breathe when they sleep, when all the muscles are relaxed. Drinking alcohol within 4 hours of sleep makes it worse, because it relaxes the muscles further. Smoking, somebody smokes, it will swell the airways and make it more congested, and they have more chances or have more incidence of sleep apnea, and if they have it, it is worse. So these are the major risk factors and features of it. Now, somebody has enough suspicion, or if we have enough suspicion that one person has sleep apnea, what to do? We have sleep lab here in the hospital. It's in the 3rd floor, and it's going to be moved next month. Yeah, soon it will be moved to the new place, which is much more spacey, and we have more beds. But basically, it's very comfortable rooms with beds. Patient comes at night, and they introduce to the whole procedure, so they get familiar with it. They get connected to 18 wires, and these wires will be, some goes to the head to check the brain waves, so we can tell what stage of sleep they are. Some will be in the nose and mouth to see if there's any air flowing, some in the chest and abdomen to see if there's any movement, and we check the heart if there's any arrhythmias, and we check the oxygen to see if it drops. So they spend the night there, and most of people, they do very well with that. They have no issues with falling asleep, and it's always a concern. But we find most of the time people can sleep during the night. So at the end of the study, we look at mainly sleep apnea, but also we look at other things. If there's any heart issues, we might find it. If there's any seizure, sometimes just happens at night, so we look at that too. And we schedule a follow-up and go over the treatment options. Now, how we treat it. The treatment could be sometimes just life modifications and some adjustment. If somebody has mild disease, doesn't have much symptoms, we can encourage to lose weight. What we said about smoking, about drinking, sleep in the side, and sometimes that's all what's needed. If it's significant, or if there are risk factors, blood pressure, heart disease, then we have to treat. And the first line of treatment is a CPAP machine. I think most of you are familiar with that, or heard about it, or have some horror story about it, but it's not really that bad. And it's not a CPAC, it's a CPAP. So this machine, it's an air compressor. It's a small device connected to tube, connected to a mask. And what it does, it pushes the air in, so it opens up the airways. What happens in sleep apnea, when the person who has that goes to sleep, it gets completely collapsed. it closes, and they cannot get the air in or out, and that can happen for 10 seconds, 20 seconds, 30 seconds, sometimes up to 1 minute. And if it happens so many times, it causes all the side effects. Normally you can have it 2, 3, 4 times every hour, that's still normal. Anything more than 5 times every hour, that's a disease. So the CPAP machine will be the first line of treatment, and it will be fitted in during the second study if we decided that that person needs to be on a CPAP, so they will have another CPAP study. It will be a similar condition except they sleep with the machine, so they get familiar with it, and we know how much pressure they need to be on to overcome the blockage in the throat, in the airways. After that second study, we arrange for the machine. About 70% of the people, they do well with the machine, and some of them, they need some adjustments where go up or down with the pressure, add the humidification to it, try different kind of masks. So if we work hard with them and they are motivated to do it, about 70-75% of the people, they do very well with it. There are still about 25%, whatever you do, they're not going to like it. So with these people, we try different things. One option will be something we call dental appliance, which is a device by specialized dentists. They put it in the mouth, and the idea is to pull the tongue out, so it creates space behind the tongue. Or some of them, they pull the jaw forward, so it also creates space. So there are two different kind of them. It has not been used much because a lot of times people cannot tolerate things inside the mouth. If the teeth are not strong enough to support these devices, it might not work, and a lot of times the insurance will not pay for it. But that's an option for people who cannot tolerate CPAP machine. The third option would be a surgery, and there are different kind of surgeries ranging from removing tonsils and adenoid for kids to removing the uvula, which is the thing that comes out of the roof of the mouth, with some cleaning, to a more extensive surgeries where they cut some muscles and reattach it, so they create space behind the tongue and they can breathe. Now, some people will need oxygen with the machine if they have especially chronic lung disease, COPD, or if they have some other condition. So this machine can be attached to the oxygen, or the oxygen can be attached to the machine. Of course, a lot of times if it's weight related, losing weight could be a cure. Not easy, but if they can lose weight, sometimes they might not need the machine after that. So they don't get addicted to it or dependent on it. If for whatever reason they get cured from sleep apnea, and mainly weight loss would be the way, if it's weight related, they will not need it down the line. And I think my time expires. So I'll conclude, and if you have any question, I'll be glad to answer. Yes, ma'am.
You could look at the person and tell they have it?
Well, not necessarily, but
what tells you that from looking at them?
I have a power. No. There are certain features where, for example, if you check the circumference of the neck, if it's more than certain number, for female and male, they have, then the chances of sleep apnea is very high.
If they have a large neck?
If they have, short, thick neck. What's that, sir?
Not a football player.
Well, not a muscle. If we're not talking muscles, but football player can have it. I think a couple of years ago, somebody, White, what's his first name?
Really?
Reggie White, yeah. He has sleep apnea, and his death was a kind of complication to it. Oh. But I'm talking about if it's redundant fat weight in the neck. But not necessarily. I've seen some people who are very thin and have very severe sleep apnea.